To understand if a patient needs a root canal versus pulling a tooth and extraction, I follow a certain model of practice that I believe in. Nothing is as good as your tooth. Our goal is to never let anything happen to your tooth, and that's why we push to bring somebody in when they're very, very young from an early on age, because I'd rather teach and educate somebody not to get cavities, because nothing is as good as your natural tooth. Of course, there are certain things that we can't control. A diet for certain patients, brushing habits, oral hygiene habits, or genetics. So unfortunately, some of our patients do end up getting cavities. Again, if we can treat these cavities with simple procedures, we can keep this tooth as long as we can. And when something new happens on that tooth, again, we want to try to save that tooth as long as we can. Everything has a lifespan to it, including teeth, including a filling, including a root canal. And if we start pulling a tooth at a very early age and we replace it with something like a dental implant, the dental implant's going to have its own lifespan as well. And what do we do after that fails, if that fails? Then you have no more options afterwards. So my goal when somebody says, why should I save my tooth with a root canal as opposed to just take it out and give me an implant? You may end up in an implant, but my goal is for you to be able to have something there until the end. And if we just rush into doing this, pulling the tooth and getting you an implant, you may not have many options if that fails.